3 simple skincare tips to look younger. That's what I'm talking about today. Please like this video. If you like these types, I'll produce more of them. But many people just want to look more youthful or maintain their look without the aging process taking effect. So let's start by saying, what ages people? What do I see in my practice of people that they come in, haven't seen them in a couple of years? What is it on their face that's aging them? There's 3 main elements. One is bone. Now the patients don't know about bone, but bone loss makes people look old. Not necessarily tired, but old. When you see someone that you haven't seen in a long time, they're looking older now. Think about bone. The second thing, the skin. Of course, skin, fine lines, wrinkles. And the third thing is sag. Now, sag is complex. It's not as simple as we think. People think everything falls. Of course, if you lose bone, things do fall a little bit, but we know the fat pads grow. They also shrink. They grow where we don't want them to, and they shrink where we don't want them to. So think of those areas, and that's why fillers do play an important role. Today we're talking about things mainly you can do at home, but we do replace volume and remove volume when things have gone too far to where topicals and skincare treatments don't work. I want to show you this picture of the bone just so you understand how dramatic this is. This is the jaw and the side of the face. You can see in the person that's aged, the bone has deteriorated. And in the body, the bone, we can work on it by activity, by exercise, but in the face, the head's on a bobble, hard to work on your bone. That's why I talk about supplements like K2, vitamin K2, and maintaining your facial bone, but you at least get a visual. The second picture here, I'm going to show you the fat pads in the face. You have to understand when you do an anatomic dissection and you're looking through the fat pads, it's not like you can see these demarcated very easily. It all looks confluent. For your purposes, they're superficial and deep. They're both different, but superficial fat is what people see when you see a malar pad or division of fat pads in the face, but you can see how complex. The older versus the younger patient, fat pads play a role. Today, one of the main things we're talking about is collagen loss. Because even if you get a facelift, it's not going to help produce collagen. And for the purpose of today's 3 factors, I'm assuming diet, exercise, sun limitation, because sun kills your collagen. Those are aforementioned. My number 3 is being on a retinol. And a retinol is something you can do at home. Retinoic acid would be the most powerful. Then you go to a retinaldehyde, which takes 1 step to form the retinoic acid, or a retinol, which takes 2 steps within the body to form retinoic acid. But that would be your kind of continuum. If you can take the side effects, I would say, of a retinoic acid, that would be preferable, then retinaldehyde, and then retinol. And I mentioned the ones that I like in my complete tutorial. But that's my number 3, because when patients come in, I haven't seen them for a while, or I'm seeing them over time. We do 3D imaging, as you know. So I'm bringing to you what I do in practice, and I measure things. We're doing a lot of studies in my practice. You have to measure things. They're on a retinol. So that's number 3. Number 2, AHA, alpha hydroxy cream. Now, HA creams often have a BHA or beta hydroxy acid in them as well, but you'll know AHA is from glycolic or lactic acid. And I'm not talking in this case about the peel, but a skin cream. And the reason is it helps exfoliate. They've been shown to help with brown spots, and that light reflection is something that ages people. When they lose light reflection and glow, separate from sag, but the AHAs work on the outer surface of the skin. They also help to promote collagen growth, and importantly with the exfoliation, all the other products and treatments that someone does work better because of that exfoliation. You now have a fresh layer of skin. You have a responsibility in this, because you need to take care of that fresh layer of skin, because the fresh layer of skin is also going to be more sensitive to sun. It's going to be more sensitive to treatments that we do in the clinic, like lasers, radiofrequency, and all those things. But People who look younger that come into my clinic are often on an AHA cream. To be complete, a BHA, beta hydroxy acid's often in there. Think salicylics, benzoyl peroxides, because a lot of people who are on AHA are on them for their acne benefit. But that kind of a product, not in the peel form I'm talking yet, but just in a daily cream, and some people might just use them a few times a week with the retinoids and alternate, but it's a common denominator. Number one is treatments over time. Now, you don't have to turn it off yet. I'm not talking about fillers, injections, biostimulators. I'm talking about maintaining collagen, because I said, even if you have a facelift, even if you have fillers like hyaluronic acid fillers, they're not going to make you per se look younger. They fill, they take up volume, you can create some lift. But if you see people, they have wrinkles, lines, they still look their age, they still have hollows in some areas. You can't fill everything. It's maintaining your collagen. And the treatments I'm talking about are every quarter for people in the real world where we have to work. Money might be an issue. You can't do them all the time. I recommend every 3 months, picking one of these and alternating. You're going to find which one you like. And in this class includes chemical peels. I did mention AHA creams. That has a low level of glycolic, typically 10% or less in the cream. So some people don't need chemical peels, to be honest, if you're on a good AHA cream. But chemical peels is in there. Microneedling, and I know a lot of people do this at home, collagen induction therapy with the microneedle pen. Some people prefer derma rolling. I have a complete video on my bias. And some people are on growth factor skincare with the roller. We cover that typically too. Most of my patients go home with those type of rollers. So chemical peels, we'll call all of that microneedling. The third one at home would be facials. A lot of people use masks, medicated masks, or masks with actives in them, depending on what skin. If you have oily skin, dry skin, acne-form skin, that will depend on the masks. But masks are amazing. They can be DIY. People do it yourself masks. If you know what you're doing, you have the time and effort, you can make them, you can purchase them. People who do these at home look better for it. I'll be remiss not to say LED masks. I have a complete video. I'll put the link up here to LED masks. They tend to work. People find great benefit out of using LED masks for one of many reasons, but a few times a week. It takes 20 minutes, a little bit of effort, but I think it does work well. Finally, there's home devices like RF, radio frequency, home high frequency ultrasound. I would say for most people, for ease of use, get those done at your clinic, but doing a few of those a year. Personally, I like fractionated RF. You can do RF skin tightening, but I'm referring to glow, to sag, to building collagen. And fractionated RF does so many things, so little downtime. It's not a laser, so it doesn't pick skin color out. So all 6 types of skin color can use it, type 1 through 6. It builds collagen. People who do quarterly treatments look better for it. So to recap my top 3, number 3 was retinol, number 2, AHA cream, and number 1, quarterly treatments. Whether you're doing them at home or at a clinic, that's up to you. Some of them are definitely best left to a clinic, but I know many of you are very educated and take the time to learn those things. I want to know, do you like this video? Click like. Tell me your top 3 if they're different than my top 3, but stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.